My name is Arslan Kaloon. I'm the Chief of Gastroenterology Services at Erlanger. I'm the Medical Director of the Gastroenterology Service Line. I feel that I'm extremely lucky that I'm in an organization like Erlanger, where we share a vision to really take care of our patients in the area. When I came to Erlanger, I saw the opportunity for this place where we can transform it to a new academic medical center with all the new innovation and talents that we can bring to this place. And I think over the last 8 years, we've really taken the GI service area for this population to a totally different level. We are bringing some really great innovative research-based ideas that we're now trying to put into practice, which has really shifted the paradigm for the GI care in the whole region. We're performing anti-reflux endoscopic procedures that is not available within a 200-mile radius from Chattanooga. We are doing procedures like POEMS, which is per oral endoscopic myotomy, which used to be a surgical fix back a few years ago. We are able to resect advanced colon polyps, which are called complicated polyps with early changes of cancer, where we can endoscopically resect them by a procedure called endoscopic submucosal dissection. This is a skill that is very scantily found in even major medical centers, and we are able to offer them an endoscopic resection where they don't have to undergo a big surgery and had to be in the hospital for days after that. We're able to perform endoscopic suturing. This is a procedure that is reserved for people who are just too sick, who are not even able to undergo a surgical procedure, and we offer them an endoscopic suturing. Let's say if they have a perforation or a tear in a GI organ where they're just too sick to go through a major surgery, where we can endoscopically perform these surgical procedures. We have very talented physicians who want to stay ahead of the game in terms of innovation, in terms of skill, with the right mindset to take it forward to the next level.